my name is Shamipe. I'm a first-year medical student at the University of Toronto.
Hi again, I'm Arthi. I'm a first-year physician assistant student at the University of Toronto. And this is our second video where we're going to talk about the inauguration into the program, the different programs, as well as talk about the academic aspect of the program. So
Exactly. So if you kept up with our last video, sorry if the introduction was a little repetitive, but thank you for tuning in and keeping up with it. If this is your first time, welcome. So as Arthi mentioned, we're going to talk about the inauguration, and it was pretty similar for the both of us. My program started with the Stethoscope ceremony, and that happened on a Monday of our orientation week. So the name is descriptive, and it was a whole week of orientation activities. So Arthi also had a Stethoscope ceremony. So when was yours?
It was actually the first day of class. Even though our program started like a month before online, our first day in class for the September residential block, we had it at the end of the day, so it was in the evening, so we had like one day of icebreakers and actual introduction to class.
Here.
So we were all like, it was a good night, but other than that, it was just like at the end of the day, we were all exhausted, but Stethoscope ceremony, yes, let's talk about that.
Okay, so she attended mine, I attended hers, as friends do. Anyway, so Stethoscope ceremony is analogous to what you have in the States, which would usually be called a white coat ceremony, and this is your welcome into the profession of medicine for both med students and physician assistants. And what happens is you have it's a whole ceremony, so there's some keynote speaking, some opening speeches, some congrats and getting to this point, and so on and so forth. And then comes the time of being when you actually get to be draped with your stethoscope. You do have to buy your stethoscope yourself prior and bring it with you to the ceremony. So someone calls you up. Someone
calls you up. Hopefully they don't butcher your name.
So hopefully they pronounce it right, but you have to write down how to pronounce it properly, and hopefully they get it right. They call your name. You walk across the stage. You hand your stethoscope over to the person who is going to drape you with the stethoscope. That happens. You take a picture, then you walk off the stage. You literally have probably 2 to 3 seconds of spotlight, and then it's over. For us, because our class is a lot bigger, there was about 260 of us. This took an hour, but it was fun nonetheless. The anticipation was nice because my last name is kind of later on in the alphabet. I'm gonna expose myself.
Yeah, I was sitting there with the camera. It was a long.
Oh yeah, she recorded the moment when I got to.
They butchered your name? No, I'm kidding.
We're going to
actually pretty
That was nice, and then we also got to recite an oath, making what our duty was as we were being welcomed into this into a community that we're privileged to be welcomed into, and so that was a nice reminder of what lay ahead of us and our responsibilities.
So it was like the Hippocratic Oath, right? Yeah. So our stethoscope ceremony was very similar, except there's only 28 of us in the PA program, so much shorter. And it's actually just interesting to be draped with a stethoscope by professors or practicing PAs or even dean of medicine or dean of the program, I guess. But just interesting to kind of interesting and kind of rewarding way of being welcomed into the profession. And again, the oath is a way, it's almost like a promise to kind of commit to a profession in wholeheartedly, and it kind of highlights the responsibilities, and saying it as a group. It's just nice. I don't know. I don't get emotional, so I'm just gonna leave it at that. But so I think it's quite similar, but then you guys have the O week to kind of ease you into it, which I'll let you talk about.
Yeah, we basically had an orientation week, and as the name suggests, it was just a week full of orientation activities. Sometimes we had talks about what to expect about med school, and other times we had recreational activities, icebreaker games. There was a camping event, which I did not attend.
You don't.
But I heard that it was really good. But overall, it was and this happened at the end of August, so it was a really nice way to kind of transition into the whole med school life. So we weren't thrown into the rigors. we weren't thrown into the rigors just yet, which was not the same case for Arthi.
Yeah, so I think I said this in the earlier video, but we did start the program a month earlier so that we got acquainted with the online what's the program that they use at U of T, so Quarkus, which was new this year, and then also to kind of get used to online learning for the PA program. So we did online medical terminology course, and although it was not counted for anything in terms of grades, you still had to complete the task, which required us being type A personality people to study the stuff and answer the quiz and all that stuff. So there were also 2 meetings where we attended online, got used to like the going on video and using your speaker system. It was actually, it took some time to get used to. Surprisingly, it's also nerve-wracking. A lot of people are hesitant to go on the video, including me, although we won't be hesitant to show up in class. But so that happened, and then they did warn us that we are going to start off the program, we just like hit the ground running, and that is exactly what happened. And somehow it was still a surprise for all of us, despite being warned. But we got pre-readings for clinical skills in September residential block was entirely or mostly focused on clinical skills. So yeah, the pre-readings kind of helped with that, but we started ahead and we did not have the whole week to kind of ease us into it. But we did have a few sessions talking about like reaching out to OPSA and when you're stressed and like kind of finding that school-life balance or work-life balance to make sure you don't burn out. So we had a few of those sessions, but nothing where we're like, hey, we're just having fun camping. Yeah. Actually, the first day, so the night was Stethoscope ceremony, but the first half of that day was icebreakers. No, it was actually icebreakers, and it was actually very intense icebreakers. There's something with like building something with like pasta, and it was very stressful. But later on, the second half, we kind of got introduced into a few of the things. I'm trying to remember. It feels like forever ago, but it's not. But yeah, so
to reiterate, med school orientation week was chill. You got to learn.
Was just intense.
I think it was a nice opportunity to kind of get to know classmates and to make friendships before you actually start school, and like figuring out, I guess, where you're gonna sit in the lecture hall or understanding where lecture halls are and like where your lockers are. And so it was
you
nice.
Get lockers?
Yeah, we do.
Wow.
We do get lockers. So it was nice, and I really enjoyed it, and it was a nice, easy, chill transition into med school. For PA, not so much, but really good nonetheless. So moving on.
I think it's just no. I think it like that whole inauguration part, as well as the program itself. It's like PA program is like accelerated version of like med school almost.
So everything is accelerated.
So yeah, even the transition into the program is going to be accelerated. So yeah, we're going to give you half a day of icebreaker, but then we're getting down to business. Yeah. So. Do you want to start off talking about
the academic side of things? So what you actually got in for, what the majority of your life revolves around, which is the academic part of your program. For med school at U of T, they actually just introduced a new curriculum called the Foundations Curriculum, and we will be the third round or cohort of students that are going through this Foundations Curriculum. And so I'm not sure how things were done in the past, but I think that they're better now, even though I have no prior knowledge. But anyways, what I like about our program is that it's not that you're taking 6 to 7 courses in the traditional sense. Our year is broken up into blocks. So we have 3 course blocks this year, for example. The first...
Is that similar to, is course block similar to semesters, or?
No, it's not. So our year is not broken up into semesters academic-wise. So the first course block was called Introduction to Medicine, and it ran from September to mid-October, if my memory serves me right. And then the second block started right after. There was no break, but we did have a reading break, but we were still going through ITM. In fact, I was studying for my last my second last first course block exam. Okay, so I was studying for the second to last exam in the first course block.
Cool.
And you don't need to understand that. Anyway, so it's not broken up by breaks that we get in school. Right now, after the first course block, we moved on to the second. That started after reading break, 2 weeks after reading break, and now we're still in the second course block. So even though we had Christmas break, so even though we had Christmas break,
it was not a break.
It was a break, but we were still.
You still had stuff running.
Yeah, so it wasn't like we came back in January, like forget everything we've done. It was literally just
you never really forget with these kind of programs. You gotta kind of, it's like piling up.
Yeah,
right?
we're gonna touch.
But yeah, no, we
but
no,
continuous.
Ours is not. So ours is like first semester. It's similar to undergrad, and that's first semester. But then like they like. reiterated like 50 times, make sure you like take that whole 2.5 week break for Christmas and like do absolutely nothing, because like second semester is rough.
Yeah.
Third date's rough.
Yeah.
But so definitely different in that sense. Yeah.
So different course blocks. And then how is your course structured?
So I guess like it varies in that. So it is semester system. So we do have first semester September to December, and then second semester January to April, and then third semester is a bit longer, so it's May to August. And yeah, it's long. So I think it's because it's supposed to be a 3-year program that's condensed into 2 years. The other thing is there are semesters, but then there's also within each semester there's residential block, and there's an online portion, with semester 2 being an exception. So the January to April is going to be all online, but residential block is so there's the September, it's 1 month long. December we had a week and a half, and then all online learning for second semester. With third semester starts off with residential block in April, and then the last residential block is second half of July into mid-August, and then I think that's when we have like OSCEs and stuff like that, and kind of wrap up first year or didactic year, and then kind of ease into or transition into clinical rotations or clerkships for you guys. I guess that's how it would be equivalent. But yeah,
well, we get a summer, so we get May to August off. So we're not actually in school, but. So you guys take courses, for example, within maybe your class block?
So there'll be like different courses allocated for different semesters, and then they try to like kind of space it out, or like space the hard courses out across the different semesters, so that we're not taking like all hard courses in one semester. Although I think all courses are kind of intense, especially at this level of your education and being relevant to clinical knowledge. But yeah, so we like in first semester we had intro to PA role, which was actually really nice to kind of know about the profession and how like kind of set you up for the real world, and give you more background knowledge. And then we had anatomy, super rushed. So I took a whole year anatomy in kinesiology with cadavers. This was 21 days. We had to learn the whole body minus the extremities, and minus the extremities, and a few of I'm gonna stop. Minus the extremities, and that was in 21 days, and we had our bell ringer at the end of September res block. So I don't know if I talked about this before, but residential block is when everyone comes to UFT and does their learning, whereas online portion you're at the comfort of your home and learning in your PJs. But so we had our bell ringer for anatomy, and then after that we had 2 written exams, and then that kind of wrapped up online learning. So anatomy was done with online learning. Physiology, same thing. We had 3 midterms scattered across, all purely online. LCEs are like placements, clinical placements, which will, I guess, should I elaborate on that?
We will talk about it later.
In the non-academic aspect. And then the last course is clinical skills, which was also kind of like in class during residential block, learning physical examination, medical history taking, and then online EPBL learning, which is the electronic problem-based learning, which we were tested on with written exams. And the physical exam stuff we were tested on like pass-fail in December res block. So I think it's a bit different for you.
Yeah, it is, but there are a lot of similarities. So for us, within each course block, we have different components of that. So we have your traditional lectures, basic lectures. So right now we are in the blood unit. This was filmed a while back, so we're no longer in the blood unit. So we have basic lectures, and so this happens typically on a Monday. You are in the lecture hall, you listen to the lecturers lecture on about a specific topic. Although we learn about the background and the physiology and pathophysiology of that condition, for example, we focus a lot on patient presentation and treatment and management options. And so it is different from my undergrad courses, especially because there is a direct application and you learn that in lecture, and that's the focus of your lecture. And then after that, we have our anatomy, like yourself. Anatomies are usually on Tuesdays. And this is a mix between online independent learning and dissections, or examine in pro sections, for example, which are just dissections that have been done a lot nicer for you. And so we learn the module on our own, or we go through the module on our own, and we're expected to kind of have some general background knowledge about what we're going to be doing. And in the lab itself, we don't have any like traditional anatomy lectures. They used to in the past, but as I said, it's a new curriculum for U of T, so things are done a little differently, so we don't get any traditional lectures in that sense. in the lab, we have our e-module, the computer is opened up for us, and we kind of go through step by step what we need to know and what we need to cover as we're in the lab. The next component is your case-based learning. Arthi referred to it, but it's referred to as problem-based learning. This is also somewhat online. So we are presented with a virtual patient each week who is presenting with some symptoms, and we have to work through that patient case from onset to kind of management, treatment, follow-up, and wrap-up. And so we do this in groups, smaller groups. And so in my CBO group, there's about 8 of us, if I remember correctly, or 7 of us. So that's kind of the typical size of a CBL, and you meet typically after lectures on Mondays, and you go through the patient case together. You answer some questions to the group, and then you send it to your faculty lead that's going to look over it with you on Thursday, so later on in the week. And you also have to send independent questions to the lecturer, to your facilitator before that point. Then we have clinical skills, which happen on Fridays, and that's where you learn how to take an appropriate patient history, which is what we spent most of our first semester on. And then you also learn how to do physical examination maneuvers, so ENT exams, ear, nose, and throat, and how to take basic vital signs. In addition to other aspects, we get lectures on ethics. So we spent a lot of time in our first semester learning about your leadership, like your role as a leader, as a collaborator. Again, CAN-MEDS, buzzword from the first video. If it's not clear to you by now, that it's important, it is. So we get a series of lectures on that. And one of my favorite lectures from our first semester was actually our lecture series on cultural safety and within the medical context. And so how we can be culturally aware when we're providing care to patients, and I was not expecting that. We also got to go to Loblaws, which is a chain store here, and we basically had a cooking class, and I was not expecting that coming to med school. So there've been a lot of surprises, but it literally, like, no one day is the same, and it kind of keeps us on our toes, and it makes it less routine and less kind
lots of variety.
Yeah, lots of variety within that. And then we have lectures on ethics. Right now we're going through lectures on health science research, and so how to use research information as a clinician in the future. And these lectures that I mentioned, ethics, health science research, typically happen on Thursday mornings. And we also have something called Portfolio, which is a pretty neat course where you get to reflect on your experiences as you're going through med school. And so you go to your hospital site and you sit down with your mentor, or I guess your preceptor, who kind of is in charge of facilitating that small group session. I think there's about 5 of us in my Portfolio small group, and our first session was about our cadaveric experience. So for a lot of us, this is our first time doing dissections and actual dead bodies, and so it was crucial for us to kind of make sure that we're working through that new experience intentionally, and making sure that we checking in with how we're feeling about the whole transition aspect of it. And we also have to write reflection pieces sometimes. And the last...
I think it's interesting you say that, because just December as well, the program director was talking about incorporating something like that portfolio reflection aspect, or I guess not a course, but like that opportunity for students in the PA program, because especially with the cadaver anatomy aspect of that course being rushed, it is important for students to kind of, I guess, process the emotional aspect of it while trying to learn this knowledge. So having that opportunity is definitely something that could benefit PA students as well. So potential future changes in the PA program, which is always changing, so that's good.
And the last little bit that's different for us is that we have a course called Health in the Community, and this is where we talk about how health plays out, again, in different groups and with a different facilitator. And we actually got to do a home visit last semester where me and my partner were placed with a physiotherapist who was seeing a patient who had some difficulty with mobility, and so it was nice to actually have that hands-on and on the field experience, which I think PAs actually get a lot more of in their first year, being that it is an accelerated program. So that's kind of like the bones of what the academic structure looks like. In terms of examinations, the fun aspect. Before we go into that, sorry. I would say that your program is actually a lot more online based than mine is. We do have a lot of online components, as I mentioned, with anatomy and even with the CBL sessions, but we do have, it's kind of like a balance. We go to lectures, we're actually present physically, although you can watch the lectures online later on, but there is more of a balance between in-person learning and online learning. whereas for you it's...
Yeah, it's more online. So there's a lot of, I think I said this earlier, there's a lot of distance education learning at U of T, and it's only during residential block where everyone's in the same like geographical location at U of T, and for that period of time. But yeah, I think online learning is definitely something different, and see when you're applying to these kind of programs, trying to see like how your experience in online learning has been before, but at the same time with like how technology is kind of, you know, taking over, playing a larger role in our lives. Online learning is being introduced into in-class programs as well. And I think another aspect is even testing. So we're going to transition into assessments, but even testings are being completed online, and that's also a different experience. So I guess we can start talking about assessments now.
Yeah. So I guess just to keep things consistent, for us, all our exams are online except the anatomy aspect of it, which is a bell ringer style, which is basically just you have a dissected specimen or a prosected specimen in front of you, and there's a pin and a structure within it, or a blood vessel or a muscle, whatever it may be, and you have 90 seconds to identify that piece, and then you rotate. So it's high pressure, high stakes. It's written. So that's the only time we get written on paper examinations. A majority of our other assessments are online. So we get tested, for example, for us, every 2 to 3 weeks. Based on our basic science lectures, and we all have an interface or a program that we have to download an electronic device of our choice. I just use my laptop. You download it, you go to class on the day of the exam, they give you a password, you enter it, and all your exam is in that. Your exam questions are there, you answer it, you submit it, you get your result a week or more later. All the exams for us are multiple choice questions, except for anatomy, which is obviously a different ball game. Well, how are yours?
So ours is again, it's online as well, but ours we actually just do through Quarkus, and examination time varies based on the course. But other than the bell ringer, which is similar setup, which is only one aspect, it's done earlier on in the year, but all the other assessments are, I think they're mix of multiple choice, short answers, and long answers. So you need to know your content thoroughly, and it's actually, I didn't think it would bother me as much, but it did for at least my first few midterms, where typing up the answer is okay, but it's a bit more efficient than your arms cramping up as you're writing a long answer. But the whole thought process, I like to draw things out, I like to underline and highlight different things, which I think your program has that option. But on Quarkus we don't have that option, so I'm kind of just staring at a whole big paragraph, and I'm like, okay, I need to write down the important information, and it's just a different way of test taking. You get used to it eventually, but the other aspect that we should cover on in terms of assessments is how frequent we get it. So with my courses, it was we had a midterm and final, at least for first semester, for the online courses, which anatomy, physiology, and clinical skills, I guess the EPBL learning, which is the problem-based learning, the cases, we actually had questions on them based on learning objectives. So it was more heavily focused in the final exam in December res block with just a bit of the physical exam stuff, but then the midterm exam for clinical skills midterm was more focused on the actual hands-on stuff we learned in September with a bit of EPBL on it. So that's the only course that was an exception. And then intro to PA role course, we had mostly assignments, and there was not really much there was no final exam, but there was a lot of assignments and online discussions where you had to actually contribute to the discussion and do your pre-reading so you know what they're talking about and actually provide input. And LCEs, you kind of just did placements, which we will talk about in the next video. So.
Yeah. For us, we do get tested a lot more frequently, with the exception of anatomy. So last semester, which ran from September to December, we had 2 anatomy bell ringers. Each anatomy examination is it's sectioned with its own course block. So we only had 1 anatomy exam for the first course block because that was shorter, because it was only 12 weeks long, I believe. And then we had 1 for this course block, and we're going to have another one. So we'll have a total of 2 assessments for this course block. But in terms of basic science knowledge or lectures, we actually get tested every 2 to 3 weeks. And that sounds, so we don't have traditional midterms or finals, and that's actually something that drew me more to U of T than UBC. As I mentioned in my earlier videos, I had a lot of factors that prompted me to make the decision that I did, but this was one of them. And so I find that I perform better, or I'm able to keep up with things more if I'm able to if I have a motivation to do so. So with assessments every 2 to 3 weeks, you really can't fall too behind, and with each assessment, your whole clean slate kind of restarts. Like you don't have to worry about, I need to know this information from that, but you still need to know it because this is a professional program. You're doing this for a long-term purpose of being able to provide competent care. The other thing that I should probably mention is that so in med school, and in PA school as well, we are assessed based on a pass-fail system. So even though we do get our grades back and we know what we scored in each respective examination, all that matters to the faculties that you pass or you don't pass. And because we don't take specific courses, we have course blocks. You just need a passing average in each course block. So
for us, it's just like the 60% is pass or fail.
For us, it's 74.
And so it's 60% pass or fail, and if you do fail, then I think you get like a remedial, so you get like a second chance, and you need to if it's scheduled in, like if it's a course in first semester, you need to kind of pass all those courses in first semester to come back or continue on in second semester. I'm not sure how it works, but you do have that second option, or the second try. But the other thing is, when you do it the second time, I think they say like even if you get 100%, you still get like a passing grade of 60 because it is your second time doing it. But it is good to have that option, and I think it's also nice to know that it is an intense program, and even if you do fail, then the program is not really against you as it feels when you're in undergrad. It's more like they want to help you and they know you have the potential to succeed. You did make it this far, so they give you the opportunity to kind of prove yourself the second time, and usually you are able to. It's more like circumstances where it doesn't work out the first time around. So
definitely. So same with med school. If you do, you don't need to necessarily pass every single exam as I mentioned, but if you fail one, it doesn't matter. If you do fail an entire course block, though, you do have the opportunity to do remedial assignments to make up for it, and usually it's okay. And like Arthi said, they want you to succeed, and it's so hard to fail out of these programs because you really need to not put enough effort, any effort at all, to fail out.
That being said, they do make sure you're like competent enough.
Exactly. So which is why you do need to pass things. And like for U of T, which has I think the highest passing grade out of any other Canadian medical school, the bar is set pretty high up there. So like, if you have a sufficient knowledge and you have a fundamental grasp of what you're being taught, you will be fine. It just takes the pressure off. And side plug, I actually do have a blog post about how I transitioned into thinking about or approaching exams or studying in med school. And if you're interested, you can like read it to see how I work through that. Anyway, moving on.
Well, I think that's an important point. So like, it's important. Like I think a lot of the people who get into these kind of programs we're used to. I don't say we're used to, but we set our bar so high. Like we want to get over 90%. We want to get that 95%. And when you enter these kind of programs, it's not all about grades, as long as you have a thorough understanding. And sometimes it's like, at least in my program, I can comment that we don't have enough time to learn such dense materials. So as long as you have a thorough understanding, and like sometimes your grades don't reflect your understanding. So as long as it doesn't matter if you get a 95% or a 75%, like it's more the understanding and your ability to apply that to like patient care or like cases. That's more important. So like, don't let a 75% of these kind of programs affect you.
But don't let you learn and end from there. Like maybe if
learn from your mistakes definitely. And like I always go and review my exam. Doesn't matter what my mark is. I go and review my exam because I'm like, I kind of thought it went well and it was like, lower than I expected, or like I thought I bombed it and I did well. Like how? So like either way, you go and learn from your exams, and the facilitators and the professors are always there to help you. But the other thing is like, it just reminds me of like my first physiology class when we were introduced to it in the first day. The professor's like, you guys made it. Like you don't need to get 95% like you did, like you set that expectation so high in undergrad. You just have to kind of pass. And like, yes, it sounds very like, I guess, I don't know, it kind of sounds sketchy in that like, it's like, oh, these people are just passing, barely passing, but like, it is such an intense program. Both of our programs are very intense, and that we are all going to put like all our effort into it and to learning the stuff, but don't let the grades define your competency is what I'm trying to get at, I guess.
Exactly, and to branch off from that, even the exams themselves are not just testing you on your ability to like memorize things. Our exam questions are set up in such a way that, for example, patient X presents to the ER with such and such symptoms. You have these following blood test results, for example. What are your next best steps? They are questions that test your ability to recall what you've learned, but a large aspect of it is knowing how to apply it, because that's what you need to do eventually when you're actually out there in the world as a physician assistant or as a physician. You need to understand how to treat the patients and not just, oh, that's the pathway for a heart attack. Like, no, you need to understand how to treat them, how to recognize that it is a heart attack, and like,
and the other factor is, like, even in the real world, like, not every clinician or every healthcare provider approaches the situation the same way. So when these exams and these application questions come up, you're probably, or like, I guess you're not always going to think the same way as a professor who's created the question. So sometimes your answer is not the wrong answer, like, it's just like what's the better answer. So like, it's not going to be an obvious, like, you know, zebra amongst like the horses or whatever they say, but it's not going to be like those easy multiple choice. It's actually going to be like, yes, that's reasonable. Yes, this is reasonable, but probably more reasonable than
like, what do you need to do first?
What do you need to do first?
By the time you've done your investigations, the patient is dead because you're not paying attention to the vital signs.
So there are different factors, and like sometimes it's like assessing the severity. So like exactly like that. So sometimes you're focused on one little spot, like part, and you're not taking like a look at the big picture. So there's different aspects. So again, that doesn't reflect on how much you understand this. I guess it does in a sense, but you still know this stuff. And it depends on the questions, it depends on like your state, and while you're writing that exam, there's multiple factors. So don't let grades define you.
I think that pretty much sums up what
the academic aspect of
exactly, and thus this video. So thank you for, if you're still there, thank you for your patience with us. I hope that this broke down what it looks like in terms of the academic aspect of medical school and physician assistant program. And if you have any specific questions or burning questions, please message us individually.
Feel free to reach out. And even if you have other topics or certain things you want us to elaborate on, feel free to reach out. We can answer questions or create another video potentially. But in the next video, we'll be talking about the non-academic aspects of our program. So stay tuned.